Today we are going to study the bone of the thigh, which is called femur. So femur is a long bone. In fact, it is the longest bone in the body. It has, as all long bones have, it also has uh, two ends and a shaft. It has an upper end, a lower end, and a shaft. Now, to determine the side of the bone and also to know the anatomical position of the bone, we need to know all the aspects of the bone. That is, which part of the bone is the upper end, which is the lower end. We also need to determine the anterior and posterior aspects of the bone and also the medial and lateral aspects of the bone. Once we determine all these aspects, we can easily know the side of the bone, and also it will be easier for us to know the anatomical position of the bone. So, as you can see, the upper end of the bone has a rounded head. This way you can know this is the upper part of the bone, and obviously the other part will be the lower part of the bone. Then we have to see which side is the medial and which is the lateral side. Head, as it has to articulate with the acetabulum of the hip bone, so it is directed medially. And to know the anterior and posterior, we will have to see it from the side. If you can see the curve of the shaft of the femur is convex anteriorly. So if you put the convexity anteriorly, automatically you will know the anterior part of the bone. To know the anterior posterior, we can also see the lower end. The lower end, these two large elevations, which are known as condyles, they have a big notch in between them. So this notch is kept posteriorly and there is no notch anteriorly. So this is how you will know the anterior and posterior aspects of the bone. Now once all these aspects are known to us, we can easily know this bone belongs to the left side, as the head is directed medially, shaft is curved anteriorly, and the head also is lying superiorly. Now we will start discussing each part of the bone individually. First, we will start from the upper end. So the upper end of this bone has a rounded head, as you can see here. After the head comes the neck, and after the neck comes two elevations. One is this is called the greater trochanter of the femur, and this small projection here is called the lesser trochanter of the femur. Now, as you can see, the head of the femur is more than half a sphere. It's not complete sphere and it's not half sphere, it's more than half a sphere, and it is directed upwards and medially, and it has a small depression on its medial aspect, which is called the fovea of the head of femur. This thing is called the fovea of the head of femur. Now coming back towards the neck, we can see the neck. This is the anterior aspect of the neck. So the anterior aspect of the neck is relatively flat, and it joins the shaft at a line which is called the intertrochanteric line. This structure is called the intertrochanteric line, as it is a line between the greater trochanter and the lesser trochanter. So it is called the intertrochanteric line, and this intertrochanteric line starts from the greater trochanter, move towards the lesser trochanter, and if we move backwards, it comes on the shaft in the form of a spiral line. Intertrochanteric line moves at the back of the shaft of femur in the form of a line which is called the spiral line. So if we move the femur backwards, we can see here that this structure here is called the spiral line of femur, this thing. Now this is the posterior aspect of the neck of femur. You can see the anterior aspect was flat, but the posterior aspect is concave. You can see its concavity, and it joins the shaft at another line which starts from the greater trochanter and ends at the lesser trochanter, but this line is a bit elevated as compared to the intertrochanteric line. So this is called the intertrochanteric crest. If you can see at this point, a little above the middle of the intertrochanteric crest, there is an elevation, and this elevation is called the quadrate tubercle. Now coming towards the greater trochanter, we can see that the greater trochanter has a superior border which ends posteriorly in the form of a sharp structure which is called the apex of the femur, apex of the greater trochanter of femur. It has three surfaces. One is the anterior surface. This is the anterior surface of the greater trochanter of the femur. This surface is the lateral surface of the greater trochanter of, and if you can see closely, there is a faint ridge on the lateral surface of the greater trochanter of femur. Then moving towards the medial side, we can see that the greater trochanter has a medial surface as well. So this is the medial surface of the greater trochanter of femur, and it has a depression, a shallow depression in its middle, which is called the trochanteric fossa. So the greater trochanter has a superior border. This is the superior border of the greater trochanter, and it ends posteriorly in a sharp tip which is called the apex of the greater trochanter of femur. Now it has three surfaces: an anterior surface, and it has a lateral surface. This is the lateral surface which has a faint ridge, oblique faint ridge in the middle, and it has a medial surface which shows a trochanteric fossa. And this small projection posteromedial to the neck of the femur is called the lesser trochanter of femur. So this was all about the upper end of the femur. Now coming towards the shaft of the femur, if we take a cross section of the middle part of the shaft of femur, it has a triangular appearance. So it has three borders and three surfaces. As you are looking at the medial side of the shaft of femur, you can see that this is the faint rounded medial border of the shaft of femur. Coming posteriorly, you can see here, this is the sharp posterior border of the shaft of femur, which is also called the linea aspera of femur. This sharp ridge is called the linea aspera of femur. Now coming towards the lateral side of femur, you can see here, this is the faint or rounded lateral border of the femur. Going upwards from the middle of the shaft, if we go up and follow the linea aspera, you can see it divides into two parts. One is this, which is the spiral line, which was continuous with the inferior part of the intertrochanteric line of femur. So this intertrochanteric line, it comes down and continues down on the back of the shaft of femur as the spiral line, and this is the spiral line, this structure. Coming back, the linea aspera itself goes up and joins another structure, this large tuberosity, which is called the gluteal tuberosity. So in the upper part of shaft of femur, just below the lesser trochanter, you can see it has four surfaces and four borders. One is the gluteal tuberosity, one is the spiral line, and this encloses a triangular posterior border. Then on the medial side, as we have already seen, this is the faint medial border, and the surface between the medial border and the spiral line will be called the medial surface. And coming back on the lateral side, the area between the gluteal tuberosity and the lateral border will be called the lateral surface of the upper part of femur, and between the lateral and medial borders, the lateral and the medial borders, this will be the anterior surface of femur. Similarly, in the middle part of the shaft, between the medial border and the lateral border, this is the anterior surface. And between the linea aspera and the lateral border, this is the lateral surface of the shaft. Between the linea aspera and the medial border, this will be the medial surface of shaft. So in the upper part of the shaft, it has 4 borders and 4 surfaces. In the middle part, it has 3 borders and 3 surfaces. But as we come down, the linea aspera again divides. Now this is the middle part of the shaft of femur, and coming down you can see that the linea aspera has again divided into 2 lines. One is going laterally, and this is called the lateral supracondylar line. As this structure is called the condyle, these 2 structures are called condyles. So the line above the condyle will be called the supracondylar line. So this is the lateral supracondylar line. You can see that this is the lateral part of the femur, and this line is the medial supracondylar line, and it reaches the medial condyle of the femur and it ends in the form of a tubercle, which is called the adductor tubercle of femur. So in the lower part of the shaft of femur, we can now again see 4 surfaces. One surface is enclosed between the 2 supracondylar lines, and this surface, this triangular surface, is called the popliteal surface of femur. Then it will have a lateral surface between the lateral supracondylar line and the lateral border of the femur, and this is called the lateral surface of femur. Similarly, on the medial side, between the medial supracondylar line and the medial border of femur, you can see the medial surface of femur. Then again, between the medial and the lateral borders, you can see this is the anterior surface of femur. Now coming towards the lower end of the shaft of the femur, you can see that it is expanded from side to side. It has 2 expansions. One is on the medial side. As you can see, the head is on the medial side, so this expansion is on the medial side, and this expansion is on the lateral side. These 2 expansions are called the condyles of femur. So this is the medial condyle of femur, and this is the lateral condyle of femur. As you can very clearly see that the lateral condyle of femur is more in line with the shaft of the femur, but the medial condyle projects medially. If we see the lateral condyle from the side, you can see that there is an elevation on the lateral condyle of femur, and this is called the lateral epicondyle of femur. And just below the lateral epicondyle, you can see here there is a groove which is called the popliteal groove of the lateral condyle of femur. Coming towards the medial condyle, similarly, you can see that it is a large elevation which is called the medial condyle of femur, and it has a similar projection on its medial side, and this is called the medial epicondyle of femur. And the medial epicondyle of femur projects upwards in the form of an adductor tubercle, where the medial supracondylar line comes and ends. Now this part of the condyles of femur, this is the articular part of the condyles of femur. As you can see, there is a transition from rough to smooth. So this smooth part of the condyles is the articular part of the femur. So this anterior part of the 2 condyles articulates with the patella, and the lower part, this one, it articulates with the superior part of the condyles of tibia. Now coming posteriorly, you can see that there is a deep notch between the 2 condyles of femur, and this is called the intercondylar notch. And the superior boundary of this intercondylar notch is marked by a line which is called the intercondylar